Hello and welcome to the Science on the Seventh live stream. My name is Pallavi Pant. This is a place where we talk about air quality and health related topics and bring guests from around the world. Regardless of where you live and are joining us from right now, the last few months have been pretty extreme and extraordinary. We've seen countries and regions experience extreme heat events. We've seen wildfires impact air quality in many parts of the world. And we've seen other natural disasters. And often, when we talk about these topics, we hear that there's impacts on air quality when there's wildfires. We hear that air quality gets worse when there are heat events. And today we are going to spend our time talking about these links between air quality, climate, and health, and unpack some of these linkages and why do we know this and how do we know this. Let me bring on two extremely wonderful guests today who will tell us all about air quality, climate, and health and the work that they've been doing. First, I would like to welcome Dr. Abhiyant Tiwari, who is working with the Natural Resources Defense Council. He's based in India and has been working on heat and health for many years. Welcome, Abhiyant. Very glad to have you here. And second, I would like to welcome Dr. Robbie Parks, who's joining us from New York, where he works at the Columbia University. He's an assistant professor there and has also been working on climate, health, air quality for several years. Welcome, Robbie. Great to have you both with us today. And I think I have a lot of questions for both of you. But first, because we've seen this happen very recently, Robbie, you're in New York. I live in Boston. And in June, we had these severe air quality episodes where the situation, looking outside the window was pretty apocalyptic. And we know this is because there were wildfires that resulted in poor air quality both in Canada, parts of Canada, and also large parts of the US. Like millions of people were living with air quality alerts for several days. How do you think events like these change or influence the conversations that we're having about climate and health? How was it for you personally experiencing this bad air quality event? And, how do you think it sort of changes how we think of these issues?
Thanks, Pallavi. That's a great question. Personally, as I sit here in New York, I have a view out my window, which is normally extremely, clear on a good summer's day. And, the last few weeks have been very, very evocative in the sense that you look out the window and the sky's orange and the Manhattan skyline has disappeared and everyone's still wearing masks again outdoors and things like that. So really, in terms of its visibility, it's sort of slightly different from the idea of the remoteness of climate change. The ability to ignore it. It's really vastly reduced in the ability to just ignore it. So the idea of it driving policy change and the way people think about it, I think, is very important. And of course, it's combined, unfortunately, with extremely high heat at the moment, especially in certain parts of the south of the United States. But air pollution has been a rather effective lever for policy change historically in a public health sphere over the past few decades. Many wonderful scientists have been working on lowering limits. So, if there's anything to say about air pollution, it is quite an effective lever for policy change and for getting people to think about the health impacts. And so, the intersection of climate change and air pollution in many different ways, but in terms of wildfire smoke, it would provide a good platform, I think, for thinking again, or reminding people, or making very present exactly the problem, which is both climate change and air pollution and obviously equity issues, because although it's blanketing the entire city, the health impacts will be varied. So yeah, I do think it's a good way to focus the minds of society, let's say.
Yeah, you mentioned orange skies, and I think we have an image to show people if they haven't yet seen what it looked like in parts of Northeast US. This was pretty bad. I think for some like me and Abhiyant, you might agree with this. These scenes were really reminiscent of what Delhi and parts of northern India look like in winter. Not as orange. We tend to be a lot more gray, but the heaviness in the air, not being able to see very far, it really changes the way we experience air quality. And Robbie, as you also mentioned, heat events that parts of the US are currently experiencing. In fact, in the news, we saw that July 4th was one of the hottest days that we recorded across the globe. So the average global temperature was higher than what we have been recording for many, many decades now. And Abhiyant, you have been living through this in India. The last few months have seen a series of extreme heat events. In fact, if I can switch the images almost and go to a map from India, many parts of the country saw extreme heat events just in the month of June, and even as far back as February this year, when I was home with family. It was unseasonably hot. I couldn't believe that February would be hot enough that I would need a fan in the room. So, Abhiyant, how do you think heat waves, because they have been in the news, people have been talking about it, and people have also been talking about the relationship between heat waves and air quality, and what we need to do to talk about health and how do we protect the health, especially of those that are most vulnerable. What are some of the impacts we're seeing in people's health? And again, how are we seeing the conversations change or get influenced by these events and the way that, these are becoming more and more frequent now?
Yes, thank you so much, Pallavi, and thanks, Robbie, for reflecting on what's been happening on air quality part in US. And I must say that whatever is US's leadership uh, has been uh, uh, a key driver across the globe for India also on heat aspect, but on air quality aspect as well. So you're right, Pallavi. We have seen worst extreme heat conditions recently. What the 1.5 degree threshold that we were assuming to restrict by the end of the century we are already seeing that crossing now. Like we have seen, days crossing that threshold recently, which we were assuming that will restrict by end of the century. And not just days, we shouldn't be, negligent to the fact that there could be an across the year, the average global temperature would cross that threshold. You're right. India has experienced some of its very, devastating heat spells in past few months, and not just in past few months, but the trend has been increasing, and it has been, like how we call in health sector, we call the dual burden of disease, the air quality and the heat. They both are causing the dual burden of disease. So it's not just the heat, but also the ozone. You might have observed, that in certain part of the Delhi, and say it's just where we observe it. If it doesn't mean where we are not observing, we don't have such conditions. But along with the heat, we are also having this issue of ozone, the bad surface ozone, pollution that is also affecting the health of the people. So heat has been hitting us really hard, um, much more than we expected it to be. We have heat action plans in place, but they are very, I should say, superficial. Good part is that India, US, and countries across the world, and several organizations and governments are putting efforts to address the issue of extreme heat, at least towards adapting towards the rising temperature. But there is a lot to be done. If I say I'm a member of a committee of Global Heat Health Information Network, which is a joint venture of World Health Organization and World Meteorology Organization, NOAA, and other academias and other institutions across the world who work on the issue of addressing extreme heat and health. But we are still not seeing air pollution as a co-factor to address this issue. So that is something also we need to, and because most of the hospital admissions or deaths that we see during the extreme heat days, we see a lot of admissions because of the respiratory illnesses. So what are the causes behind that? We need to understand the air quality as well, monitor that as well in a better way to understand the combined impact of both heat and extreme heat in the current situations and in the times to come.
Yeah. No, that's actually really helpful. And I just wanted to mention a nugget that I learned while getting ready for this, which is that the Global Heat Health Network that you just mentioned, that you're a part of, Robbie was involved in getting that set up several years ago. So, Robbie, I'm actually curious, health often is the one piece which links a lot of these disparate topics together, whether we're talking about wildfires, air quality, extreme heat events, other types of natural disasters, hurricanes, floods, all those things. Health becomes that central place where all of these dots start to connect. And this is something you've been working on quite a bit. Like, how do these different pieces connect? How do they connect with health? So, can you paint a picture for us on why and how these dots connect? What are the ways in which human health is really affected due to climate change related events and impacts, and how air quality also comes into the picture with that conversation?
Thanks, Pallavi, and thanks, Abhiyant, for that wonderful answer. And yes, it is a small world. Yeah, the Global Heat Health Information Network. I worked with my friend Nate and Joy Schumacher Guillemot, and so it's wonderful to hear about it again. So of course, climate change. You could sort of divide it into many different, or climate related exposures, if you like. You could divide it into many different experiences. So you've got ambient sort of experiences like temperature, and then you've got disaster based sort of experiences like hurricanes and wildfires that spread. And then of course you've got in between. So of course you can get smoke that drifts in from other places, and so all of that really combined. And then of course you've got floods from hurricanes and droughts and so on and so forth. But the panoply of hazards that come with climate related exposures is really, the list goes on and on. So the impacts on people's health can be very wide ranging, and unfortunately most of the time, the vast majority of the time, it's all pulling in the same direction. That is to be bad for one's health. And so you've got direct effects from disaster based episodes, and I guess heat wave can be classed as a disaster. And so you've got people dying in the very immediate aftermath. That could be from drowning in Queens, which is a borough in New York City. A couple of years ago, with Hurricane Ida, unfortunately, you got people drowning in basements, drowning in cars, driving around trying to escape. And then you've got the sort of more or indirect effects, but still related, which are harder to link up in some ways. So, for example, people dying of heart attacks and cardiorespiratory events, perhaps say in a hurricane or smoke, because they've inhaled a lot of smoke and their body is under increased stress, or because they're actually trying to clean up, or they're in an unfamiliar environment. And then so we're talking about physical health there, but there's also mental health impacts, really. So we're talking about something like neuropsychiatric disorders, suicides, assaults, dying by suicide, increasing with rising temperatures, but also in the short, mid to long term, the idea of losing hope where you are, and your whole sense of home and your whole sense of place is gone. And if you're in an unfamiliar environment and you're used to being cared for, your rates of survivability after a disaster vastly decrease. And so, there isn't really any part of public health that isn't touched by climate-related exposures and climate change. So, and then of course that's not even getting into who is most vulnerable, because that is a whole other element of it that sits on top of this. And so, air pollution fits into that whole spectrum of hazards. And as Abhiyant has sort of successfully put forward, it's really the idea that it's a threat multiplier. Like if you've got all these things coming together, to sort of use a bit of jargon, there will be non-linear impacts. It won't just be the addition of an air pollution and a heat event. They're actually going to be worse than each one combined. So yeah, that's really an overview of the interaction between climate change, air pollution, and public health, I would say.
Yeah. No, that's sort of, so many layers to this. And as you said, it's not a direct one-to-one sort of result we're going to see or impact we're going to see, but different things interacting. And I think when we start thinking about countries where we don't yet have adequate healthcare mechanisms or safety nets for people that may be more vulnerable, these problems become even more acute. And Abhiyant, I'm wondering, since you have been working on heat action plans in the Indian context, and also thinking more actively about healthcare systems and how they can be better prepared to treat and to interact with people that are affected by things like extreme heat events, as we're thinking about these multiple layers, and we're thinking about low and middle income countries where there may not be the right resources, the right systems in place, are there additional factors that can come into play? And how do we think about adaptation in that case? How do we think about making sure people have what they need, both in terms of information and action? And are there lessons that we are already learning from this type of work happening in India or in other countries?
Um, yes, thanks, Pallavi. And I must reiterate what Robbie said, that if we talk about vulnerabilities, there is a whole range of spectrum that we can think of about the vulnerabilities. I mean, the vulnerabilities, uh, could start from macro level to, thinking about the regional or, different parts of the of globe vulnerable to heat or air pollution, let's say, to coming down to regional and, national, and I would say even at household level. People living in the same household are differently vulnerable to heat or, air pollution because of their range of factors, their age, their work, work condition, um, and things like that. So, yeah, I mean, these are the challenges, and I would also like to reflect upon the question, in the previous question that you asked to Robbie about the disaster part. So, unfortunately, like, and Robbie addressed this very well. Like, unfortunately, heat and air pollution, they both, we know that they are among the, even heat is the number one natural killer in US, right? Uh, 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 Among the natural hazards or disasters. Uh, but unfortunately, heat and air pollution, they both are not still categorized into the uh, heat is not notified disasters, neither in India nor in US, right? Same goes with air pollution. The unfortunate part is that, unlike, hurricane or earthquake or flood, where we see the impact directly on people, right? Where the impact on health, where the impact um, on infrastructure can be seen directly, is not seen or may not be correlated directly in case of air pollution and heat, and that's what makes it even a bigger challenge for people like us, like people from science and advocacy background, to make it a case. And but that doesn't mean that it's not affecting. We have seen, events like 2003, European heat wave, the current heat wave in India, the past in I mean, heat. I should not talk about heat. Heat is making impact. We need to make a case better. Um, but good part is that the heat action plans are working. The early warning systems are working, at least in protecting the health of the people by making them aware about what impacts can, the rising temperature or sudden spikes in heat, temperatures can make on their health, and how they can protect them. But it's not about just protecting the life of the people now. It's more about protecting the life and livelihood both. So we need to go beyond from just saving the life, because, if I talk about the vulnerable communities, it's about the trade-off between bread and butter and life. If they won't go out, like countries in LMICs, uh, you know, those are who are at the bottom of pyramid. If they will not go out to earn their bread and butter just because of, I'm sorry. just because of they have to protect themselves from the temperature or the exposing themselves from the heat. They lose their bread and butter for that particular day, which is a bigger challenge. So we need to understand such intricacies here, and ensure that it's not just about heat action plants, shouldn't just about address saving the life of the people, but should also think of saving the livelihood of the people. So how can we make short term and medium term and long term policies in that way that can protect not just health but also the livelihood of the people in the times to come?
That's such an important point. I think, focusing not just on human life and saving and protecting that, but also livelihoods. And Robbie, I'm curious how you think about this, because in the US context specifically, we do hear, when we think about heat and external exposures, certain groups that come up from time to time, like agricultural workers who are out there, working in fields for long days, and other vulnerable communities that may be getting higher exposures, may not have adequate ways to protect themselves, and their jobs equally require that they be in those conditions. So, how are cities and governments in the U.S. thinking about it? Um, are there additional or different uniquenesses in how we think about this issue in the US? Because I'm sure, as Abhiyant was saying, going from global to local, there are many layers again that we can think about this, like who's vulnerable, what do we need to do. So how are we thinking about this in the US context, and what are the additional factors that we should be thinking of in this conversation?
Yeah, thank you for the question. Every country is different, and beyond a debate about who is historically most responsible for climate change and all that kind of stuff. Um, in the US today, it to have someone impoverished and to have someone unable to be able to plan and have hope for the future, that's a societal choice. I mean, there's more than enough resources to have everyone resilient and hopeful for the future and have enough resources. So when you think about climate change here in particular and the people who are most vulnerable, at some point along the way, there has been a choice to say that that is okay. And so I won't speak for other countries, but that certainly applies, I would say, in other countries too. But I'm just talking about the US. And so when we think about resilience, when we think about the way cities plan, if cities do not, if they make a certain choice, and the federal government makes a certain choice, then that vulnerability will remain. And there's lots of very good research to suggest that that telescope of the ability for those health disparities to exist over the length of a century, for example, with regards to racist policies in the United States, that's a choice. And so, just really, I would, if anyone would like to remember anything about it, is the idea of climate vulnerability is a choice. Yes, we are all vulnerable to climate change and climate-related exposures, but we do not need to have people in society unfortunately at the bottom who are as vulnerable as they are. It's a choice. Yep.
Yeah, I think that sort of brings that thought in mind, like we're all equal, but some more equal than others. And another thing that I feel like you've both sort of touched on a little bit is that this is such a layered problem. It's not like a simple you go from A to B and this is what happens. But also in a similar way, for many people, this is also a deeply personal issue. We've all sort of thought about it, engaged in it in very different ways. And what makes us hopeful or perhaps anxious about what's to come again is based on a whole set of factors. And Robbie, you wrote a really poignant piece recently that talked about this issue, and especially, going back to what you were saying, not just about the physical impacts that we see in people, but also the mental health impacts that we can experience. And I'm curious to hear, like, how you sort of got interested, motivated, involved in work around this topic. What is keeping you motivated to, keep working on this issue as it sort of gets more attention and requires a higher prioritization. Can you talk us through that a little bit?
Thank you. Yeah. Are you referring to sort of the idea of the mental health related impacts of climate and
Yes.
loss and damage? Yeah. So of course, like that I wrote a very personal essay, and thank you for reading it. But largely it focused on the idea of how to deal with with losing things, and losing things happens all the time. People unfortunately live for a certain time and then they no longer live. So it's about how people deal with that when they're left behind, but it's also really relevant with regards to loss and damage in the climate in the climate change sphere. So how to appropriately compensate, if at all possible to compensate. You can't really compensate for someone's loss of family, loss of livelihood, loss of culture, but to go some way to do that, I think that is the sort of issue of our time, really, with regards to a global policy on loss and damage. Because I was at UN COP 27 in Sharm el Sheikh, and that was a huge deal at that point. And that goes to really the heart of what I was saying before, the idea of it being a choice. It is a choice that we keep countries impoverished because they're under these very restrictive debt collection policies, global, and so like they can only focus on very, very small things, not improving their social infrastructure, etc., etc., etc. And that is a choice. But what keeps me going is the idea that there is still something that, from a public health perspective, that I think we can do, and I think what we can do is not just show the issue from an epidemiological point of view, this is people at risk, but actually identify ways in which that can be resolved. And I think that really is done by showing not only that climate change impacts your public health, but your health, but it impacts every element of your health. And so that's why mental health is really important to me, because I think it is a sort of another effective lever in that space. So yeah.
Yeah, that's very interesting, and I think the whole sort of loss and damage piece of the climate change negotiations and the conversations is picking up pace and for the right reasons. And as you say, I think trying to balance that, yes, there are impacts, but also, here's how we can be solving those and addressing that to the extent possible. Abhiyant, I know you've put in a lot of time and effort in actually making those things happen with cities, officials, and governments sitting down and talking through these things. How did you get interested in this type of work, and what gives you hope and motivation to continue going? Are there things that we can take away from this that are actually helping us change what's to come in future? I think you may be muted still. The story of our
I'm sorry.
times.
Yeah. Sorry. So, well, this is very like a very personal question. But what motivates me, or what motivated me to be in this space, or in this space of public health. So, Robbie and I, we work on environmental health part, and a big uh, part of my work is the early warning system. So what brought me to work in this space is basically the early warning systems. I started working on heat waves back in 2000, 12, 13, from the first heat action plan of India in the Ahmedabad. And that also has a personal story. So, I mean, this may not relate with air quality or with heat both, but if any of you know, we had a very unfortunate event of Kedarnath flood in 2013, where I had a personal, event. I mean, my parents were stranded there in that particular. Luckily, they came out of it. But what I read about the most in the news, and heard the most in the news, is that the meteorology departments did issue notice around that cloudburst and that flooding event, possible heavy rain and flooding event. So early warnings were issued, but not, warnings were issued, but not, taken properly, or, whatever happened. I related that with my initial work on heat action plan, which is again an early warning system, for heat related health impacts. And that's why I thought that early warnings are important if they are, implemented properly. And now we have evidence. Like recently, I read somewhere that countries with early, a properly effectively implemented early warning systems have 8 times, for all the disasters, have eight times lesser mortality rates than the countries who do not have early warning systems in the place, effective early warning systems in the place. So they do play a role, and that's my personal story, which like really motivated me to work on this particular issue. And then, of course, coming from the global heat is a big issue, which we typically don't understand mainly from the tropical countries, that heat is a very normal phenomena for us, but it's not like that. We need to understand heat in a more detailed manner. So yeah, that's my personal motivation and story behind working on this issue.
Yeah, wow. I do remember the Kedarnath floods, and that's where my family is from, like that state where the floods happened. So yes, I think though, sometimes really what may seem like really small things for the world can just be triggers for something big. So I'm very happy that you're both working on this issue and continuing to share what you know and translate that for wider audiences. And thank you very, very much for joining us today. I think we learned a lot. I have so many more questions, but I think we're coming up on our allotted time. So hopefully we'll catch up with you another time to talk more. And people who joined us and are listening in, thank you so much for joining us. You can follow the work that Abhiyant and Robbie are doing through their social media channels and websites. I think the links are in the chat. And thank you for joining us to listen in about climate, air quality, and health. We will be back on August 7th to talk about air quality interventions. What are cities doing? What is working to improve air quality? And we will be joined by Dr. Haneen Kreis and Mr. Thomas Lyons. And that conversation will focus really on solutions. So put in a reminder, join us on August 7th. And until then, stay cool. Um, thank you very much.
Thank you.